If they hurt their shoulder immediately, we start working on them. If we have any type of pain past 2 to 4 weeks, we definitely want to get more imaging. Just take a look deeper into that soft tissue, make sure we didn't miss anything at all.
Hey, Dr. Mike, I have a few questions from patients. Do you mind if I ask you them real quick?
No, go ahead.
Okay. The first one is, how can I tell if my shoulder pain is serious?
Good question. So a couple things we're going to look for on an exam of the shoulder, right? So patient comes in with an injury. A few things you want to look for. One, you want to make sure you don't have any crazy swelling going on that just kind of appeared out of nowhere. The other thing you want to make sure is that you don't have any bruising that just showed up pretty quickly, especially that deep, dark purple bruising that you've seen on some people. A couple other things I would say is if you have any type of radiating type pain. So if you notice that you hurt your shoulder and suddenly you've got pain or nerve tingling sensation going down into the hands, that's usually not a good thing. And last thing is, and this is probably one of the most serious, is that if you hurt your shoulder and then suddenly you have like a bump that wasn't there before, you notice something sticking out that wasn't sticking out before, that's something you definitely want to be looked at immediately.
Okay. And then how do I get my shoulder to stop hurting?
That's kind of a loaded question. So a couple things, right? It's always going to depend on the injury and kind of what you're dealing with. But some of the biggest things you can do that's going to help the most is one being physical therapy, right? The other one being chiropractic adjustments for that joint. And then the last one is things like trigger point injections or IM or intramuscular injections, we call them. So on the chiropractic side, anytime we have an injury, we know that joint's not going to be working right as far as being aligned properly and moving properly. So that's the point of the chiropractic adjustment, is we want to make sure that joint's lined up so that everything's gliding appropriately in that joint. Then those trigger point injections or that IM injection I was talking about actually can come in, and that's going to help relax the really tight muscles that are in there just to help that patient feel better a little bit quicker. And then obviously the PT side is going to be one of the most important in the sense of we're really going to have to start strengthening that shoulder up, stretch any muscles that got really tight, strengthen the ones that are over loose so that we can just protect that shoulder from further injuries.
And then can shoulder pain be a symptom of something else?
Yes, 100%. That's a great question. So a lot of the times we have patients come in and they'll say, hey, I got shoulder pain. We'll kind of point up here to that trap area. It's all connected, right? So definitely part of the shoulder, but when we go to do the exams and we take a look at things, a lot of the time some of that pain is coming from the neck, right? So all of the muscles in here, and the shoulder is a complex joint, right? We've got the AC joint, the SC joint, the glenohumerus joint, the shoulder blade all working together. Well, all the muscles and nerves that come out of the neck come into the shoulder. So it's very common that we actually have an injury in that neck and it's just radiating or referring down into the shoulder, and that's where we'll feel the most amount of pain. So even though it feels like it's in the shoulder, we definitely want to take a look at the neck as well.
What is the most common cause of shoulder pain?
So most common cause of shoulder pain kind of varies, right? So most common type of injury we see is what's called tendonitis. Our shoulders, like I said, being as complex as we are, we see a lot of patients that are always like this with texting or we're working on the computers. A lot of what we do is in this anterior position, so the shoulders tend to be rounded out. When we do that, the shoulder joint doesn't work properly, and those tendons and everything get really inflamed in that joint. That's what tendonitis is, right? And tendonitis, just inflammation. So those tendons get inflamed and it really starts to cause pain for that patient.
How long is too long for shoulder pain?
I don't like anything kind of longer than anything like 2 to 4 weeks. So we'll always tell patients as they come in, if they hurt their shoulder immediately, we start working on them. If we have any type of pain past 2 to 4 weeks, we definitely want to get more imaging. Just take a look deeper into that soft tissue, make sure we didn't miss anything at all. But again, at that 2-week mark, the patient looks at us and says, hey, look, about 30 to 40% better, well then we know we're on that right track, right? If strength is coming back, pain is going down a little bit, then we're on the right track. We just make sure we keep going from there.
Yeah, makes sense. How does a rotator cuff injury feel?
A couple different things you can feel. One is any type of abnormal clicking or popping every time you move that shoulder. One of the most telltale signs though is if you pick your arm up out to the side and as you go to bring it down, it just kind of drops and gives out on you. Actually happened to me while I was playing baseball. So that's pretty indicative that you tore one of the rotator cuffs.
Okay. How long does it take for a rotator cuff injury to heal?
It depends on the severity, right? Typically you're looking at about 4 to 6 weeks if it's not a complete tear. If it's just a partial tear, kind of sprained it, we can get you usually pretty good in 4 to 6 weeks. If it is one of those complete tears or something, obviously that's where that MRI will come in, and we're looking at a lot longer recovery because we're probably talking surgery.
Understood. And then how can I check myself for a rotator cuff injury?
Dr. Google. No, don't do Dr. Google. There's actually 3 things that you can do pretty easily to do at home just to check. One is what I already talked about. So bring that arm out to the side, and if you go to lower it slowly and you feel like it just kind of weakens and gives out on you, that's one test that would say, hey, go get it looked at and get it assessed. The other thing you can do is put your arm out in front of you, thumb down. You're going to take your other hand and just push on that arm and try to resist. As you push, if it feels really weak or you have pain in that shoulder, again, you want to go get that looked at for a rotator cuff tear. And then the last one is actually just sit up nice and tall in the chair. Put that hand behind your back with your palm facing away and just lift the hand away from your back. If you can't lift off of your back or you feel pain while you do it, again, that's usually indicates that we have some type of rotator cuff tear. So you definitely want to go see somebody for that.
Okay, thank you. Dr. Mike, do you mind if I stop by with any further questions I have from patients?
No, absolutely. Anytime. Come on over.
All right, thanks.